What all the literature shows and a lot of studies show, particularly the National Cancer Survivorship Initiative, is that patients are well looked after during their treatment when they're having chemotherapy or their radiotherapy, but at the end of treatment that patients often feel quite lost and find it quite difficult to sort of work out where they're going with their lives, and that's really why we wanted to get going with some survivorship work in Swindon.
So we looked at what we could set up for patients to try and support them more at the end of their treatment, so they can then go on and live as good a life as they can possibly live with and beyond cancer.
We've talked about the initiatives that we've brought in to Swindon, and so the first thing that we talked about was a psychotherapeutic group which myself and the clinical psychologist Anna Lagerdahl ran for patients at the end of their treatment. Once they were in remission, and then they attended a group where they could work in a psychotherapeutic setting to work out some of the existential and emotional issues that they had at the end of treatment.
And also what we've introduced is that I undertook a module at the University of West of England for evidence work-based learning, and it's about introducing new projects into your organisation. So we've set up a holistic needs assessment clinic for patients at the end of their treatment if they had a diagnosis of non-Hodgkin's lymphoma. To offer them support, looking at a concerns checklist to go through any emotional concerns they might have, any physical concerns or any practical concerns, and try and speak to them about that to help them move on.
We also talked about a Living Well event which we hosted on the back of the EHNA interviews and work to find out. So we found out what their main concerns were, and then put these into a Living Well day where there were different speakers and
it was a very interactive day that we then set up for these patients to help support them more, and looked at their different concerns and tried to address those concerns. For example, the two top concerns that most patients picked up at the EHNA were that they had questions about their disease, and also that tiredness and lethargy was a really big problem for a lot of patients. So we tried to address those issues and other issues on our Living Well Day.
We're trying to set up counselling clinics within the department. Michelle's got plans.
Yes, so obviously we were only offering these holistic needs assessments to patients who had undergone treatment for non-Hodgkin's lymphoma. In the coming weeks now we want to offer holistic needs assessment to all haemato-oncology patients at end of treatment. And also we want to look at holistic needs assessment for patients that are about to undergo stem cell transplants, and look at the scoring that they do on these holistic needs assessment to see whether they need any additional help from, say, the clinical psychologist if they're really struggling with emotional needs.
And also to carry on doing Living Well days, to do some more of those, I think will be really important.
So I hope it's really just to keep on trying to embed the recovery package and survivorship initiatives within our trust.
I would really encourage people to attend these days, because it can be very, very supportive to meet other people that are in similar situations, and I think that's a big thing, not to feel so isolated. It can be a very lonely experience having gone through treatment for cancer.
And I think, for holistic needs assessment, this is a personalised care plan that we come up with and work, to solving the issues that patients are having between the patient and the healthcare professional. So it's very much a team effort, and I think, that's something that we can work on with these patients to try and improve their lives after cancer.
I think the other big thing is for patients to be kind to themselves and to actually realise that it does take time after the end of treatment, and not to expect to get back to normal straight away.